Dr. Sam Dubé here once again for the Toronto Business Journal, and I'm joined today by the Executive Director of the Association of American Physicians and Surgeons. She is also an internist, Dr. Jane Orient. Thank you for joining us today.
Good morning, Sam. It's a pleasure to be here.
It's wonderful to have you. Now, I was reading some articles on the association's website. Could you please give us some background about the Association of American Physicians and Surgeons, otherwise known as the AAPS, such as your membership numbers and your history?
The Association of American Physicians and Surgeons was founded in 1943. At the time, there was one of the early efforts to institute socialized medicine in the United States, the Wagner-Murray-Dingle Bill, which would have been universal health care, rather like what they have in the UK, in which all Americans would be obligated to participate in this, a taxpayer-funded and taxpayer-controlled access to medical care. And we have stood by the traditional medical ethic of the Oath of Hippocrates, where physicians are working for the good of their patients, not for the good of society, not for the good of the planet, not for the good of our overseers, but for the good of our individual patient. And probably the most important line in the Oath of Hippocrates that everybody thinks about is never do harm to anyone, has been obliterated from all of the substitutes that are now being used in medical schools.
Yes, and having gone through that route myself, I can say that looking into it a little bit, it was quite shocking, the influence of certain corporations, individuals, and even government on medical agenda and curricula, as well as treatments and protocols and such. There were a couple of articles that struck me from your site, association site, Dr. Orient, and one of them was about the concern of blood clotting with regards to the pandemic injections. And the other was with regards to the necessity of early treatment. And so I would like to address the latter first, because as you had mentioned to me in a phone conversation, you feel that this is among the most important topics. And we know definitely that there was a concerted effort to suppress early treatments. And one of the big reasons is that due to the emergency use authorization, where in order to maintain that, there could not be any other reasonable treatment available. And so there was a huge conflict of interest there in terms of the available treatments, especially early on in the infectious state. And now the Fauci emails lending a lot of credibility to that, that there was a concerted effort to suppress early treatments. So could you speak to this a little bit about the association's position on this?
I think that the most shocking feature of this epidemic has been the attempt to suppress and even in many places to ban early treatment. We don't see this with any other disease. With herpes, with HIV, with heart attacks, with strokes, with everything, or cancer, the emphasis is on diagnosing it early and treating early. And this makes perfect sense. And it is just beyond belief that an effort is made to keep doctors even from finding out about early treatment. I think hydroxychloroquine was the thing that first came to the fore, and then ivermectin, or just vitamin D. And Dr. Fauci takes vitamin D himself. He will admit to that. But one doctor, Dr. McCullough, had his website purged of information about vitamin D, even though there's study after study that shows that people who are vitamin D deficient, which includes most of us, certainly people who live above the 35th parallel, cannot make vitamin D in the wintertime. So we have, instead of flu season, we have vitamin D deficiency season. And that people who are dying of COVID-19, almost none of them were vitamin D deficient. So and certainly with all this concern about racial disparities, that dark-skinned people tend to be harder hit by this virus, one of the reasons is likely that they require more sunlight to make adequate vitamin D. And most of them spend their time indoors too. And so instead of telling people check your vitamin D levels, be sure you have enough, especially if your skin is darker. But even that is censored from the internet.
Yeah, they're definitely, just to reiterate, a strong correlation there between vitamin D deficiency and mortality due to COVID. And of course, when you looked at the ICUs in New York, the observation was that, wow, there's mostly people of color in here. And why is that? And one of the big kind of forgotten factors is the darker skin preventing the synthesis of vitamin D. Like we know that people of Caucasian descent have about half the vitamin D deficiency that people of color have. And so this is a huge factor. And I love that statement. There's no such thing as flu season, and there's only low vitamin D season. Yeah, and I'm very familiar with Dr. McCullough's work. I've been following him for a very long time, and it's unfortunate with that. Now, in terms of the early treatment, and what we were told early on was, okay, you've got symptoms, stay home, self-isolate, and if you get really sick, go to the emergency room, present to a medical authority. And it's like no other advice. And in my view, that's unconscionable, because there were things that could be done. And as you mentioned, there were other illnesses where this is the exact opposite tactic, where people are actually given advice on how to manage, right? And this is
right. At least you can take vitamin D, you take vitamin C, you can take zinc, you can take things that help the zinc get into your cells so it can do its job of killing the viruses. And then hydroxychloroquine is one of the things that helps zinc it into the cells. It has other beneficial effects, say on tamping down the over enthusiastic immune response. And we have known about its effects in vitro, in the laboratory, for 20 years. We were finding this out back in the 2003, 2005. We had papers about this. And then we had physicians who were familiar with this literature who were telling us about their experience. That they, like Dr. Zelenko was a leader in New York, that he was treating patients. My patients are treated early. They don't end up in the hospital. They don't go to the ICU, and they don't die. Well, it seems like every physician in the country should be all ears. That when we have something news come up, we learn from our colleagues, we learn from their experience, we learn from the basic science, we learn from the literature. Sure, we would like to have randomized controlled trials eventually, but there's no time for that. And anyway, it's been proven now that if you have careful observational studies and you control all the variables, the data you get is just as good or better than what you get from the RCTs.
Right, the randomized control.
But then we have somebody like Anthony Fauci, who sits at the head of the NIH, and he's saying, no RCTs, we can't do it. I mean, their guidance is to do nothing at all in the early stages, except now I think they do approve some monoclonal antibody treatments. They don't even recommend taking note of the D-dimers and the other parameters that refer to blood clotting.
Right.
It's just, and this is supposed to be the scientific elite that all doctors should rely on. And it's just, for them to take this position is astonishing. It's unethical. And I think it really should discredit them.
Well, I mean, certainly now with the Fauci emails becoming public, but I mean, the really incriminating stuff, I think, is the redacted stuff, which we may never see. But it's become very clear. And I mean, didn't Dr. Fauci mention something about chloroquine being effective for treating a coronavirus way back when? Like this was, I think it was all over 10 years ago. And then he just changed his position. And now there looks like there's a reason why he changed his position. More than one.
Well, I'm not sure about that. There was a publication in one of the journals that he supposedly is in charge of. And so you think, well, he was the head. He should have known about this, did he? And
right.
So there's equivocation about what he actually said. But he should have known. And if you look at the C19study.com website, where independent physicians and scientists are looking at this deluge of literature, and they have come to certain conclusions about it that you can read there. But you can get the link and read the studies for yourself. But last I checked, there were something like 219 studies about hydroxychloroquine, and the vast majority of them showed some benefit. Some of them showed tremendous benefit. And to get that many studies showing that degree of benefit, I mean, the chance of that happening if that drug were completely ineffective is about 1 in a trillion,
right,
or 1 in a quadrillion. I mean, it's just virtually zero.
And yet, in some of his latest interviews, I saw an interview recently with Anthony Fauci, where he said, if you go against Dr. Anthony Fauci, you go against science. And it was just like, that was a jaw-dropping moment. It's like, how can you equate an individual with the process of science? And when you
well, the first important thing about science is you have to be absolutely honest. And I think Fauci disqualified himself as a scientist for all time by lying about the NIH's role in funding this research on dangerous viruses in China.
I personally think he disqualified himself during the HIV crisis, but that's
well, he may have killed 17,000 people from pneumocystis pneumonia because of not mentioning that using prophylactic Bactrim might have prevented them from dying.
Right.
He insisted on a double-blind controlled study. The NIH did not fund it. Some AIDS activists did fund it. It took 2 years to have the results come out. And in that period of time, 17,000 people have died of pneumocystis pneumonia.
Unbelievable. And like you said, honesty. And then you want to talk about equivocation. Apparently there's some equivocation on what the definition of gain of function research is, right? And I do believe he perjured himself on the stand with Senator Dr. Rand Paul's questioning a few weeks ago, because claiming that they never would support gain of function. It's on the research paper, guys, that they're being thanked for the grant for doing the gain of function research.
Well, and some of the funding may have come through the Eco Health Alliance,
right,
or through a third party, but you know, it by the same guy who wrote the article in the Lancet, or the letter in the Lancet, saying that this is a conspiracy theory, and that he had no competing interests.
Dr. Daszak, who recruited 27 other people, signatories, to sign that Lancet editorial letter. We now know that the Lancet is compromised because of that. The editor has nothing to say about this anymore. One of them, I believe, changed their mind about it and said there needs to be, a lot of things have come out since then. But and then the World Health Organization sending Daszak in as part of the team to investigate the origin of the virus. Like, you're gonna send the rooster into the hen house. Good one, job. Good one, guys. So yeah, and that was one of 2 cornerstone pieces of misinformation put out there, was that Lancet editorial, and then that natural origin of the virus paper by, was it Anderson? I think Anderson, who had, in one of the Fauci emails, like a few short weeks before, it said, hey guys, this looks like there's definitely genetic markers. This thing didn't come from nature, and then a few short weeks later publishing this paper, which clearly was, to mislead. But
look, genetic engineering is what virology labs do. And that viruses are the vector that they use to transfect cells to introduce into their genome, things like to teach bacteria how to make insulin, for example. It has many good applications, but that is their purpose. And I think the Chinese have now looked at 50,000 animals trying to find the natural source of this virus. I mean, you can find Ebola virus in monkeys and bats and other animals in Africa, but they have not been able to find this particular virus in bats or other animals in China. I mean, at first it was the bat soup, and then it was the pangolin. I think the pangolin sort of just disappeared. But now they look at it and look at the genetic sequence. I think the smoking gun is really the sequences of bases in the messenger RNA that code for the amino acid arginine. There are 6 3-letter codes for arginine, and the CGG one almost never occurs in nature, but is frequently used in laboratories. And that sequence occurs in the SARS-CoV-2 virus. I mean, it seems to me that is the fingerprint of a genetically engineered virus.
Yeah, the smoking gun. And that's been known for a long time. That's been known for well over a year. And I remember, as I was telling Dr. Peter McCullough, that Indian paper that came out and lasted 3 days before it was retracted without any kind of, fanfare or apology. And basically the authors of the paper said, we will be published someday. But it said this is incontrovertible proof, pretty much that this is a genetically engineered virus. And accordingly, Chinese pressure caused them to retract that paper. But this was known for a long time. And like you said, that amino acid sequence doesn't occur in nature, but it's routinely used in genetic engineering of these type of viruses. And so, that's the smoking gun. But the problem is then this was all suppressed, right? And I remember asking you on the phone in an earlier conversation, I'm like, do you think that the people responsible for this misinformation, i.e., the mass media, will ever be held responsible? And you said something very wise to me, and me being kind of, young, gung-ho and wanting revenge and wanting accountability, you're like, I'm not as interested in accountability as I am in getting the truth out and getting the message out. And I was like, oh man, there you go, maternally disarming me. But it's but I just don't want this to continue, and I don't want this to happen again. So I think maybe we can talk about that a little bit later. But in terms of this origin, now it's become kind of vogue, and now mainstream media is starting to pick this up. And it's like, guys, it's been so long. It's been so long, and now it's getting traction. And I swear, there's literally reporters saying, yeah, well, the reason why we didn't cover this, or the reason why we tried to throw, fluff onto this whole idea and distract away from it is because, well, Trump first said that it came from a lab in Wuhan, so of course he couldn't be right. And it's like, whoa, yeah, just mix politics and science. Why not just look at the science, right? This is the thing. When you look at the science clearly, and you don't suppress anything, you don't censor anything, and you can distinguish between a good study and a bad study, a fake study, like that fake study that was retracted about hydroxychloroquine. I mean, how many people on the street know about that? And that was the basis for a lot of the media's poo-pooing of hydroxychloroquine, was they had a study, and it proved conclusively that there was no effect, that it's useless and that potentially harmful. And it's like, well, did you know that was retracted? It was fake, guys. It was fake. But of course, the media doesn't fix the mistake.
Right. It was retracted in 2 weeks, but nobody heard about the retraction. It was hugely publicized during the time that it was out there, and did tremendous harm by discouraging the use of this treatment. And I think even now, the Fauci emails are sort of a distraction, because you can talk about the Chinese communist virus and who's guilty of the lab leak or so on, but we're still not talking about early treatment. People are still dying. Hundreds of thousands of people have probably died already because they were denied access to early treatment, and we're still not talking about it.
I think fear has been used to try to control and manipulate the population. And one of those aspects is in the misinformation regarding the actual severity of the virus. No one is arguing that you can die from this. No one is arguing, but the tendency is for people who are already comorbid, who are not well, who are vitamin D deficient, who have other comorbidities, cardiorespiratory, obesity, diabetes, and several others, to pass, and that the actual morbidity is not that much worse than a really bad flu. Is that correct, Dr. Orient?
It's been hard to figure that out, because there are all kinds of incentives to pad the diagnoses. Like you mentioned before, a motorcycle accident may be signed out as COVID-19 because the hospital gets more money if that is on the diagnostic charts. And then there are the tests. I mean, this guy in Germany, Christian Drosten, came out with this PCR test within practically minutes of the Chinese releasing the sequence of the virus. And Kerry Mullis, the inventor of the test, said you can't use it for diagnosis, but any screening test, no matter what it is or how good it is, if you do mass screening, the majority of your positives are going to be false positives. And when you set the cycles so high so that you are magnifying the tiny sequence of virus by 1 trillion, which is what 40 cycles does, Now the WHO has cut it back to maybe it should be less than 20 to be reliable. You get a huge number of cases, and everybody gets very fearful about that. So I think really the only reliable statistics are all-cause mortality. And there was a little blip in that for a while, but now it's back down to baseline. Certainly in the UK, it is. Most of the US, it is. And so the pandemic should be over by any definition of the term. That doesn't mean to say that the disease is over. People are still dying. Mostly people with morbid conditions are dying, but it can be unpredictable. And what this means is that we need early treatment in everybody, which would prevent transmission as well as death from people who are infected.
Right. Let's get to transmission in a moment, because I just want to backtrack here for a moment. Dr. Mike Yeadon, who is the former chief scientific officer and I believe vice president of Pfizer, chief scientific officer for their allergy and respiratory disease section, and he talks about this many things for one, but the PCR test. And he was mentioning how the PCR test, with every cycle, you're basically doubling the amount of material that you're amplifying. And so, with 45 cycles, it's something on the order of, what is it, 2 to the 45 of the original. I mean, he mentioned the magnitude of 1 trillion times. So Terry Mullis mentioned, my test, you can basically take anything you find in the blood and amplify it to the point where it becomes something to talk about. In other words, you can basically say you can find almost anything that you can detect, even down to 1 molecule. If you amplify that, now you got 1 trillion molecules with 45 cycles, right? And it becomes something of consequence. And so them not revealing how many cycles in the PCR test, them counting, like you were saying, you get all these false positives, counting a positive test as a case, which is, I believe, what they were doing here in Canada, and telling us blatantly, 45 cycles. And then being told elsewhere that anything over 30 is incredibly unreliable, and preferably you want less. And now the announcement that they're actually reducing the number of cycles in PCR testing for people that are fully vaccinated. Gee, I wonder why. Is it possible?
Well, universal vaccination has been the only solution that is being pushed. And so we've got a virus that is probably no more fatal than the flu, and we want to universally vaccinate everybody, even those who have virtually zero chance of dying of the infection. So we really have to look at the vaccine.
Okay.
And it's a genetically engineered product. Does not fit the traditional definition of a vaccine.
Right.
And we're pushing this on everybody. It's not preventing disease. Maybe half the people who are in the hospital for COVID-19 are fully vaccinated. So, I mean, it doesn't prevent disease.
Right. And as you were saying, it's an experimental gene therapy.
It's experimental gene therapy. What else does it do? We have no way of knowing, because if the delayed effects, we're just not going to show up in a few months.
Right. Or possibly longer. Right. And so let's speak to this then. Dr. Byram Bridle, I believe his last name is spelt and pronounced, from University of Guelph, just several days ago. He was interviewed on Alex Pearson, and he had a short 8-minute sequence where he said that he looked into a Japanese study that was looking at similar type of mRNA, and finding that the assumption that the mRNA and the spike protein remain localized at the ejection site is wrong, and that it spreads.
Well, it's ridiculous anyway. We know that it goes to the lymph nodes. We know that the deltoid muscle is very vascular. So what do we expect? And the manufacturers have not come out with biodistribution studies of what happens to those lipid nanoparticles or to the messenger RNA. They just say it does its job of making spike proteins and then gets broken down. Well, really, how do we know?
Right. And the second assumption about the vaccines, the first being that everything stays in place, and the second, the spike protein doesn't cause any damage. The spike protein is safe, which we know is not true. In fact,
we know that the spike protein is the damaging part of the virus, and that it can do just as much damage whether it's attached to the virus or not. If it causes endothelial damage itself, or if just it's attacked by all of these antibodies you want to manufacture, and that attacks the lining of your blood vessels, then it should not be surprising that there's so many blood clots.
Right. And so you get this, the low platelet count and the blood clots, right? And oh man, there's so much to talk about here, Dr. Orient. But when you look at what's being pushed, like in terms of the vaccine, everyone having to take it. In the original, work, pregnant women didn't take that vaccine, right? And I don't believe children.
They were excluded. They were excluded from the studies.
And so now, isn't the CDC just saying for women, to volunteer to take the vaccine when we really don't know what's going to happen? And there have been reports of miscarriages.
Well, more than 500 of them to the VAERS system, which is probably underreporting. Do we see reports of examinations of the placentas to see whether there are antibodies to spike proteins there? I haven't seen any.
No.
And what's happening to fertility? I mean, there's speculation about the spike protein has some sequences in common with sensitin, which is in the placenta.
Right.
But that's theoretical. Have we looked at antibodies to sensitin before people get the infusion or before they get the injection and after? I have not seen that.
No. Imagine developing antibodies to that and rendering yourself infertile. Like, we don't know.
Well, and now we want to push to vaccinate all college students, just before they're producing babies. Now, we're not going to see the effects of that for a while because a lot of them are deliberately delaying starting a family. But we do have early signals in fertility clinics, and these are very frightening. And I think that one Facebook group was shut down, but one fertility clinic reported they had, for example, one egg donor who had successfully donated eggs, and there were 3 pregnancies resulting from it. On her 4th donation, they got 30 embryos, and every one of them died before day 5. Oh. And they were finding that their successful sperm donors did not have viable sperm either. This is just an early signal. I mean, it is just totally reckless and irresponsible not to pay attention to that.
I didn't even know about that. I had no knowledge of that at all. Oh my goodness. So that's really scary. And so this push, it seems really unconscionable. And especially now, like, we're looking at them trying to get the vaccines approved for children. And I know here in Toronto, they were offering ice cream to children and telling them they didn't need parental consent in order to be vaccinated. And I know that was true in at least one other state. And I mean, this sounds like not only misinformation, but coercion, right? Can a child make this kind of decision with this, sorry, you go ahead.
Well, I think they're seeing that in the US too, of trying to make it possible for 12-year-olds to give consent, and the coercion as well. If you get vaccinated, then 1, you don't have to feel guilty about infecting grandma, and 2, maybe you don't have to wear a mask and you can go out and play with your friends and so on. I mean, that is coercion. And we don't know what the effect is going to be in children already. Some children have died of blood clots. And kids die of blood clots all the time. And we don't know that it was caused by the vaccine. But how many children have to die before you say, stop, we need to look into this more. These kids do not need the vaccine. And why are we taking any risk, even if it's 1 in a million, of having your little precious baby die of blood clots?
Right. And one thing we do know is that the virus rarely has a serious manifestation in children. It seems like statistically they're more likely to be hurt by the vaccine than by COVID-19. And
well, that's true, but we don't even know what the risk of the vaccine is. Our only measure is theirs. And we know that reports are maybe 1% or maybe at most 10%.
Right.
They're backlogged. They're still working on entering data from February. And then I've seen reports to people who are looking at this saying, well, cases are disappearing. There are big gaps in the sequential case numbers. That were deaths. They're gone, and now they're putting in some other cases that have the same number of patients who didn't die. So how can you even trust them?
No. this whole reporting thing. And then I remember early on when there were only 1,600 deaths reported on VAERS, they very quickly said, we've reviewed all of these. And I discussed this with Dr. McCullough, and we're confident that none of them had anything to do with the vaccine. And now there's over 5,000 deaths and over 13,000 hospitalizations in the US alone, and not even counting the yellow card system over in the UK. That, it's like, do they have enough time to go over these? Like, how true a statement is that when a good chunk of them are dying between days 1 and 3? Do you know what I mean? After getting vaccinated. And it's like, and there's literally video of people dying in their cars, having seizures in their cars right after the vaccination. And these videos are circulating. And it's like, how can you ignore that and make this blanket sweeping statement? And it just
there were in February, I think there were 370 cases. If you did a keyword search in VAERS for things that might be related to platelet problems and bleeding, even minor ones. And then when the author of that paper, which is on our journal, in the summer issue, Journal of American Physicians and Surgeons, she found doing the same search over the same period of time the vaccines were given had gone up to more than 6,000. It had increased 17-fold, and every day it was increasing more because the data processors were catching up with the backlog.
Wow. The data processes are catching up with the backlog. It boggles the mind as to what we may see. Now, the thing that really gets me is that when people were inoculated against the swine flu back in the mid 70s, it was a very low number of people that died before they stopped completely. There were millions, tens of millions of people inoculated. And then there was something like 25 deaths or 50 deaths. I can't remember the exact number now. And then in comparison, if we compare that to today, even if we take a small percentage of those VAERS reported as deaths and take, there's more than enough, proportionally speaking, right? It's like, why don't they?
Yeah, exactly. Why is this different? And of course, with the swine flu, there were a lot of cases of Guillain-Barré syndrome.
Right.
We're seeing that with this also, or other reasons for paralysis, transverse myelitis, strokes, seizures, other neurological things, facial palsy, Bell's palsy. We're seeing hundreds or thousands of cases of this that we know about and that are being reported. But a lot of times doctors will say, well, this happens. There's no evidence that it's due to the vaccine, so we're not going to report it. Plus, there's a pain in the neck. Plus, we might get punished by our organization if we report it. Right. So this is, there's this V-Safe system you sign up for when you get the vaccine, and they will maybe call on your cell phone to say how you're doing. But I haven't been able to find out what the results are, whether people are not doing well. What good is it if they call you up and find you're not doing well if nobody else can learn about it?
Right. And Dr. McCullough complained about that too. Also, the lack of on the VAERS site of a measure of or a place to input people who'd recovered from COVID, right? Because there's evidence now that if you've had COVID, that you have a higher chance of adverse effects if you get vaccinated. And I think this is very disconcerting. And so he was advocating the use of a T-detect test to check for, subtle chromosomal realignment in the T cells, which would indicate permanent immunity, essentially. And as well as I do, we're taught in med school, natural immunity trumps vaccine immunity. It's broader, it's longer lasting. There was an estimate that if you've had COVID and you successfully recover from it, you don't have the long COVID, that you're potentially immune to 1,400 different epitopes. 1,400 different epitopes. And when you consider that the most alien variant of COVID right now, as Dr. Yeadon talks about, is 0.3% difference from the original COVID-19, right, and that your immune system can easily bridge that, because it easily will bridge and detect SARS-CoV-19 if you've been exposed to SARS from 2003. There's research on this. So there's a 20% difference there that your immune system easily compensates for. So exposure to SARS and potentially MERS confers some immunity there, and no one is talking about this, right? And so,
what about resistance to cold viruses,
right?
Other coronaviruses. And maybe few people were exposed to SARS-1 or to MERS, but everybody's been exposed to cold viruses, and there is a certain overlap there.
I think there's about 60%, according to Dr. Yeadon, with a common cold virus. And so even then that can confer some immunity. And, when we talk about kids, rarely being badly affected by it, and we talk about the potential dangers of pregnant women, it almost seems inconceivable that something is not being done to slow down and to reassess at the very least, and to stop completely and say, hey guys, maybe we made a mistake here. But when you're dealing with these public figures and the bureaucrats and the politicians, nobody says sorry, right? It's like you want to keep face. And I mean, look at Fauci now. He's digging. He's just digging. And anyway, I'll stop being outraged and incredulous here. So we've talked about the severity and the fear. We've talked about the testing. We've talked about the somewhat about the blood clotting. I want to talk a little bit as to transmission. I want to talk a little bit about, the science shows, and please correct me if I'm wrong, that asymptomatic transmission, basically, it doesn't really happen. It doesn't really happen. There's studies on this. And then with regards to the masking and the lockdowns, we know that the typical mask, the holes in the mask are bigger than the virus particles, and that maybe the only thing the masks will do is when you sneeze and you see that spray, there's virus in there. So if you're symptomatic and you're coughing up, essentially droplets and chunks that are full of the virus, it might prevent that. But for people that are asymptomatic, the masks do very little. And in fact, you can still inhale the air. And we know COVID-19 is airborne. We know the virus is airborne. So what are your comments about the masking? And then I want to ask you about the lockdowns.
Well, before 2020, masks didn't work for stopping transmission of flu and so on. Only after 2020 did we find some studies. But if you look at the studies, the difference in transmission or lack of transmission with or without the mask is very trivial, even if some of them reach statistical significance. Like you say, if it is airborne, and the CDC has been busy denying that it's airborne, just like they were for Ebola. And if it's airborne, it doesn't matter how far away you are. It's in the ventilation system. You should be cleaning the air, not wearing the mask. And then there's the issue of what are people inhaling from the masks. Like a lot of these masks are made in China or other places. I think they had to withdraw tens of millions of them in Canada after they were giving them to children because they were inhaling graphene from the mask. Little tiny fibers that get into the lungs. Do we know the long-term effects of that? We do not. Look at them under the microscope. You can see the shards of fiberglass coming from some of them. Plus, they accumulate all the germs that you breathe out.
Right.
So really, the masks are harmful just besides the fact that children are frightened by them. They can't read facial expression. It impairs their language development.
Right.
And it makes everybody mad at each other. I mean, it's not just the fear, but it's the guilt and it's the finger pointing. If I get COVID, it's your fault because you weren't covering your face.
Right. Or if I get COVID, it's your fault because you weren't vaccinated. When in fact the vaccine is the vaccinated person, right? Or the injected person. So yeah, there's a lot of contradiction here. And, so in terms of the masking, like I said, the Fauci emails are showing a different picture that many people have suspected or known about for well over a year, with just looking at the science. And that's one thing that really angers me is when, they invoke science, which is not science, it's scientism, right? Exactly. And then they go, I'm a god of science, therefore listen to me. And it's like, no, you're actually misquoting the science and you're cherry picking, which is not science, and you're completely dishonest, which is not science, right? So if we look at the lockdowns now, there was a Canadian professor, I think his last name was Allen, please forgive me if I got that wrong, Simon Fraser University, who did a 80 article meta-analysis on the lockdowns worldwide and found that there was a 282 times more destructive in terms of life years lost due to the lockdowns than the virus itself. And so what is your position on lockdowns or your comments on the lockdowns?
Well, they haven't worked anywhere. I mean, it is absolutely clear that they cause a huge amount of damage to human life, not just to the economy, but damaging the economy, destroying your business, destroying your livelihood, has an effect on human life too. But even just the casualties from lack of medical care and so on, the lockdowns have unquestionably caused huge harm. But there's no correlation between the transmission of the disease and the severity of the lockdown. Even in areas in Denmark that were otherwise very similar, there was just no difference. It does not protect anybody. It may impede developing herd immunity, and there's just absolutely no justification for it.
Right, and yet they continue. And where
Yes.
I live, they're still on, and I look longingly at, videos of the UFC in Florida, going, whoa, when's that going to happen? Again, here, at least in the US, there's some dissent, with the two-party system. We don't have any such thing in Canada,
Unfortunately, we don't have very much medical pushback here either. I mean, you cannot get information on early treatment from organized medicine or from the standard medical journals except to try to debunk it. The AMA just came out with a survey that purports to show that 98% of practicing physicians are fully vaccinated. That's a total, the N is 300 people that they surveyed.
Oh,
so AAPS sent out a survey just yesterday. We already have more than 500 physicians, and it shows that it's 60-40, 60% not vaccinated, 40% vaccinated. And while some of them seem to believe that it's safe and effective, the majority of them are seeing significant adverse effects in people who've had the vaccine. So the physicians are getting their information primarily from organized medicine, which is reliant on the NIH and big pharma. And there is significant dissent in the medical profession that just is not being made known.
Dr. Orient, what message would you give to physicians right now in the US or elsewhere? I mean, certainly the situations are different depending on the nation that you're in and the jurisdictions under which you work. But what message would you give to physicians who are kind of, sitting on the fence going, I got to follow my organization and the official stance and yet do no harm. And I want to help my patients. And, like I'm hearing stories left, right, and center where I live about physicians, talking to their patients, quote unquote, off the record. And then others that are, they've drunk the Kool-Aid. They've really drunk the Kool-Aid. So what would you say? What could you say to them?
Well, I think a lot of them may believe that it's coming from organized medicine and the important academics. They're afraid because their employer will not allow them to talk about this, or because the insurance panels that they're on are not allowing it. So there's fear. And then, the fear combined with guilt that if you don't protect yourself, you're putting your patients at risk. But physicians, I think, need to remember they are supposed to be professionals. They are supposed to exercise their own judgment, read the literature for themselves, and put their patients first, not compliance with the top-down dictatorship. That they really do need to take responsibility for their patients.
But you and I talked yesterday briefly about, you have some background in stats. I have a PhD in math and I'm into pattern recognition. And when you have colleagues that just read the conclusion of studies and pay no heed to the analysis, it's very difficult to have a meaningful discussion with them. And, it's like, I found people just shut down. And it's like, when you look at the basic statistics, so for instance, look at something as simple as the wildly claimed effectiveness of the Pfizer vaccine at 95%, completely confounding absolute risk with relative risk.
Yeah.
That's a simple one. It's a simple. And then, of course, now the stats they're trying to push to say that the vaccine is 100% effective with children. It's 100% effective without the vaccine, but based on the analysis. Like, it's simple math that people aren't even willing to look at because they trust or they don't want to know. it's like they want to languish in ignorance to pass the buck. I don't know. What are your thoughts on that?
If you look at the numbers that were coming out of like the Pfizer tests and so on, this 95% effectiveness is based on like 200 cases of mild COVID in 22,000 people
Right.
who were in that arm of the study, which means that your risk of getting COVID was so low.
0.8%. It was 0.8%.
Yeah. Okay. Well,
you're right. It's almost exactly.
Maybe there's a less than 1% absolute risk reduction.
Yes. Yeah.
And maybe a 95% relative risk reduction. And then there were ways of, who suspected they had the placebo, so they were more likely to get tested. So there are all kinds of problems with that analysis. And it does not require any calculus.
No.
Notice that. No,
it doesn't. And this is so sad that people just don't want to listen. And you just need to do a little bit of digging. And I don't even know what else to say about that, quite honestly. But if we look again at people who have been exposed to COVID and who successfully, dealt with it, and this long-lasting natural immunity, do you see any way of distinguishing them from those who haven't had COVID and those who've been vaccinated, because of all this concern about the vaccine passports and, creating this two-tier society now and getting a yellow dot on me, you know what I mean? Like, is there a way to mark people? Do you see a way around this now? Or do we just try to fight against these vaccine passports and mandatory vaccination completely?
Oh, I think we need to fight against it, because I think the risk of getting the vaccine is unknown, but it's certainly greater than the risk of dying of COVID in most of the population. But in the elderly population, with a lot of comorbidities, they were not included in the studies either. And some nursing homes had patients who were doing fine. They get the vaccine, and then a third of them or half of them die after the vaccine. So we just really can't say that the vaccine is helping anybody.
Right. So, no, go ahead, please.
And I'm not sure how to overcome all of this totally pervasive propaganda. And I think that if we wait for a lot of people to die in case there is this antibody-enhanced disease, if the vaccinated people later get exposed to the current variant or other variants, then it's really going to be too late.
Right. So you're talking about antibody dependent enhancement. Now, my concern is that there may be more illness brought about because of that, but then they'll just blame the variant. They'll put a spin on it, right? They'll just say it's because
and say you need a booster. Need a booster. And then the infertility thing. What are we going to do about that? We know that a lot of the most powerful vaccine proponents believe that the world population needs to be reduced drastically.
Okay.
Bill Gates thinks a 10 to 15% reduction would be great. That's more than 1 billion people. But other people think it should be lower any more than that. Is it any coincidence that they're pushing mass vaccination? I mean, that would be one tool to accomplish it. We do know that the vaccines have been developed deliberately to cause infertility. Is that what's going on here? We don't know. And all we can say is that how much of a risk are we willing to take?
So I'm glad you brought it up, because I did want to ask you about that. And, when you follow the money and you look at the conflicts of interest, a pattern appears for sure. And certain individuals with vested interests, financial and political, definitely appear. Anthony Fauci is one. Daszak is another. There's many. And then my question to you would have been, what would the ultimate goal be? So let me specify. Was the pandemic an opportunity to invoke certain protocols and restrictions? So for instance, was it seen as an opportunity to get this vaccine going where we could use it to, control population? Maybe you tell me. Or was this even planned further back? in that, when we look at the lab leak hypothesis, which is now gaining huge traction, and many people have known for well over a year and longer, when you look at also the evidence that the Chinese patented a vaccine prior to the pandemic being declared, and when you look at the series of patents on the coronavirus and testing years prior to that, as exposed by Dr. David Martin, then another pattern emerges, one that is much longer in time frame. What are your thoughts on this possibility, Dr. Orient?
Well, I think it's very frightening, and there are a lot of connections and a lot of flows of funds that are suggestive. Maybe we should believe what people tell us. Like the founder of Moderna, or at least a very high executive, said, we are engineering the software of life. And they say that we've had research on these vaccines for 20 years. Well, they can't have been researching a vaccine against a virus they didn't know about. But if you go back and look at the literature, which was really strange to me, I hadn't known about this, at the genetic engineering that's been going on for 20 years. They really are trying to affect the human genome. They are trying to affect behavior. They're trying to affect your neurons, your emotional responses. Lots of experiments in animals. We know that they would like to have a more compliant human population. And we know that because they've told us as much. They're looking for transhumanism.
Right.
They use AI. They want to be able to influence how people think and how they behave. And maybe they can do it, maybe they can't, but it is important to remember that once your genome is changed, like once they take their genetic scissors called CRISPR and take out a section of your DNA and replace it with something else, that is irreversible.
What do you say to people that claim, oh, that mRNA vaccine, that can't rewrite your DNA? And yet I do believe there is precedent for that it is possible, that this does happen, and that there's some research in this involving platelets, and there's a few other papers. So what do you say?
I would say that they don't know that it can't, and that the mRNA can get into the nucleus if it comes with certain things, maybe these lipid nanoparticles, that mRNA has been used for that in the laboratory in certain circumstances. And then we have like the adenovirus vectors in the J&J and AstraZeneca vaccines. Adenoviruses are very commonly used. They do get into the nucleus. They do alter the DNA in the nucleus. That's what they're used for. That's what they're researched for.
So the potential to rewrite our human genome is very real.
We have people talking about that. That's their ambition.
Right.
And of course, they will say, well, we just want to cure diseases, or we want to make it possible for a paralyzed person to operate his prosthetics by his thoughts. Well, all that's wonderful. But I don't think that DARPA and other military agencies are in the business of trying to help paralyzed people or to cure cystic fibrosis. The Pentagon and DARPA are one of the major funders of these virology laboratories. They have another objective that's in their mission.
Okay, yeah, and certainly I've spoken about DARPA with others in the past. So you do feel that there is something going on here involving the Defense Department, much more higher magnitude funding and experimentation, and that the vaccine is part of this. Well,
we even had Undersecretary of Arms Control saying, well, we shouldn't worry about the fact that the People's Liberation Army, the Chinese Communist Army, is investing in virology research. After all, the U.S. Army has been doing that for decades.
Yeah.
No problem.
Yeah. It's just like Fauci saying on the stand that, they're trustworthy. The Chinese researchers are trustworthy. I don't know where that came from. That was desperate. That was pretty desperate statement. Okay, so let me get into some more specifics here because I didn't know we would be going this way here. But what are your thoughts on this term hydrogel that you hereabouts, thereabouts, and what it consists of? What do you know about this? What are your thoughts about this?
Not much. I have barely heard of it. I haven't had time to look into it, but I think if they're talking about worried about microchips, about implanting things in your body, it doesn't have to be a little thing, like you put in your animals to track them. It could be a kind of hydrogel that's not so easily tracked and can get down at the molecular level.
Right, exactly. And so, yeah, and I too, I don't know enough about the technology to comment in a really educated way about that, but it does seem like there's some potential there. Now, this so-called magnetism that we're witnessing on the high wire, they took random people and asked them if they were vaccinated, and about a third of them had the magnet stick, and it was pretty clear. They weren't sticking. There wasn't moisture or sweat or oil or anything, and the angle didn't seem to matter that much. It was apparent there was an attractive force between the person near the injection site and whatever device they were putting on their arm, which allegedly was a magnet. Do you know anything about the potential there? I've heard some talk about a ferromagnetic protein being synthesized. When I first heard about it, I was like, well, I need to see it. I need to see it. First of all, I want to feel it. And I haven't done any testing myself. But I was thinking, well, we got ferritin, right? And is, the iron in our hemoglobin being concentrated. So, it would have to be this huge concentration. So, there's allegations about a 9,000 time increase in the amount of ferritin in that injection site. And some people seem to have it, it's localized there, it's concentrated there. Have you heard anything about this? Because I really don't know much about that at all, and whether it's potentially of concern or not.
Well, I've seen the videos. I'd like to see it for myself. I've only done a few tests and they've all been negative.
Right.
I did buy a little device for measuring a magnetic field. I haven't had a chance to try that out yet. I know some physicians who are looking at that. Maybe you should get a compass and see whether it attracts the compass point. I just really don't know, but I know that there is research into magnetogenetics as well as optogenetics and ways of trying to alter the signaling in your nervous system in a way that might be controllable from the outside. There's a huge amount of research on it. I am not expert enough I've only learned about the existence of the field, but there is very advanced research reported extensively in the literature regarding these items, and doctors really need to know that it exists and look into it.
Yeah. So do you think, I know it's not your area, but what purpose would that serve in order to, either inject someone with something that would cause synthesis of such material? What purpose would that serve in your mind? Being speculative.
Well, I think that there are people who have ambitions to control human behavior and have said so. So I don't know whether it's possible. It sounds very science fiction-y. I just know that there's a lot of research on it. There's a lot of money that's been put into it, and that we don't really know what all is in those injections that you're getting. mRNA, but it codes for spike protein. What else? I don't know. Do you?
No.
How would you find out?
No, exactly. So how would we find out? Would it take independent lab work? Would it take, more long-term studies, Dr. Orient? Like what can be done in that regard? Would it be banned research? Would the results be similarly suppressed?
Well, if you have a corrupt research establishment, and it all depends on funding from the NIH and from the government, and that's riddled with conflicts of interest and with influence from places like the World Economic Forum, DARPA, the Bill and Melinda Gates Foundation, and on and on. And if you want to know what's in the vaccines, well, I suggested sort of, flippantly, well, why doesn't somebody hire a homeless person to do some dumpster diving out behind the Walgreens or the vaccination centers. And I was told, well, these are carefully locked up in biohazard containers and so on, and access to the place where they're disposed of is very tightly controlled. They have surveillance cameras over the vaccine vials. So you can't just steal even an empty vaccine vial. You might only need a few drops to put through a GC mass spectrometer and see what all is in it, but you can't get it.
Why the high security? Why?
Yeah, I wonder. I mean, this is garbage. Is it so dangerous? It has to be a biohazard. We're injecting the little kids and it's dangerous, or they're afraid you're going to take a few drops and sell it to somebody. I mean, why don't you just toss it in the trash like your empty vial of penicillin?
Dr. Orient, they're going to claim intellectual property, right? That's going to be an excuse or something.
Oh, that
else.
Could be, it's proprietary.
I mean, they're going to claim that, but you know as well as I do, like, come on, seriously, like, just going to be another excuse. And I love how Gates was asked by a reporter, are you ever going to release the patents on this so that people can just synthesize these vaccines throughout? No. And then of course Biden says, yeah, we will. So it's like, what's going on here? And we know that Gates was in it for the money. He said the vaccines were the greatest investment he's ever made, and now he's kind of become lower profile because of the Epstein controversy and his divorce. And I think maybe they're afraid of some things coming out. And do we really know why he's getting divorced? Like there's rumors, right, about that, and his involvement with Epstein. But he did state that the vaccines were his greatest investment, and so it would serve his financial best interest to release intellectual property regarding these vaccines. And he even said it's not as if there are these large factories just ready to manufacture vaccines, and we know that's entirely untrue. There are literally new factories sitting out there across the world waiting to manufacture vaccines, right? I mean, there's footage.
Well, there are, and Bill Gates does not need any more money.
That's for sure.
He's got more money than he ever could use, but money is a tool. A lot of people do want money. Big pharmaceutical companies or the AMA or medical journals or academics want to fund the research work. So money is a tool. But I think that people who are already multi-billionaires, nearly trillionaires, making more money is a relatively innocent motive compared with a messiah complex, and that they really want to save the world from humanity.
Well, yeah, save. I'm going to ask you a few questions that we kind of glossed over. The status of ivermectin in the US, at least. What is the status of ivermectin right now? Because I'm not sure.
Well, the status is that doctors can prescribe it.
Mm-hmm.
There are some pharmacies that either say they don't have it or they are reluctant to fill it. But so far, all of my patients have been able to get their prescriptions filled.
Really?
Some people go, yes.
Okay.
It's much more expensive, I think, than it would need to be. But people are getting their prescriptions filled.
Is it true that, was it Merck is creating another version of ivermectin to?
Well, Merck has been saying, oh, our own product doesn't work. You shouldn't use our product. But I think they are working on another type of drug that they would hope would be new and be very patentable and very profitable.
Right. And of course, way more expensive than ivermectin was.
And I mean, a lot of hospitals are refusing to allow doctors in their hospital to prescribe it. And you've had to sue the hospital to demand that the patient be allowed to receive ivermectin. But if the doctor is willing to write the prescription, the patient should be able to get it.
Okay, so that is true then. I have heard, I'm asking you, that there's been cases where patients have sued to have access to ivermectin. So you're telling me this is true?
They were in the hospital, under the control of the hospital.
Okay.
And the doctors were refusing to prescribe it. Even patients who were at death's door, they got ivermectin, they got better, but then they started to relapse. The doctor refused to give another dose, and the hospital was sued.
Oh my!
But I mean, why should you have to have a lawyer? I mean, why shouldn't you be able to talk to your doctor and say, "Look, this worked before. Why won't you prescribe it again?"
especially one with such a low side effect profile, and that and hydroxychloroquine as well. But ivermectin seems to be very effective no matter what stage of infection you're in.
What seems to be, and it seems to be preventive, and we have such a long history. There are people in Africa who probably take a dose every week to deworm themselves because they're exposed to so many parasites. And look at how many animals have taken. There have been at least 1 billion doses of this drug dispensed in the world for people, not counting the animals.
So the question is, given this so-called emergency pandemic situation, what is there to lose by disseminating ivermectin to the world's population? What? I guess that's
maybe your profits in these vaccines.
That's my point.
But for the individual doctors, they could lose their whole career.
Right. So my question to you now then is, if we start to adopt these early treatments, now the emergency use authorization, how long is that going to last? I don't think there's a time limit on that. Is that correct?
No, there's no time limit.
Okay. So in order to mandate vaccines, of which the Association of American Physicians and Surgeons is against, and yes. What is required in order to mandate these vaccines, as far as you know?
Well, they would need to have FDA approval for the vaccines. And really, they should not be able to get that until at least the preliminary studies are over, which won't be until at least the end of 2022. But there's a lot of pressure put on them to give full approval earlier. Mm-hmm. I think we need to remember some history, like with the most notorious pharmaceutical mistake was
thalidomide.
Was with the thalidomide. Yeah, could this be the new thalidomide? That was approved in 1957. Mm-hmm. In 1961, the same obstetrician who was prescribing to his patients noticed some babies being born without any limbs. And it took until 1962, which is 5 years, for that to be withdrawn from the market. I mean, there were less serious complications that were overlooked. You had the same doctor seeing the patients. The person who shoots you up in the vaccine center is probably never going to see you again. So they're not going to make the connection. So it could take a long time for long-term side effects like infertility, cancer, birth defects, autoimmune diseases to show up.
Right.
And then if something happens right after you get the vaccine, they can still say it was a coincidence, but it's less convincing than if nothing happens for 5 years.
Exactly. And it's funny because I was surfing last night on YouTube, and there was a video from, I don't even want to say their names. I don't want to give them any airtime, but this group of guys, very popular, over 1 million hits on it. And they're interviewing Anthony Fauci, and it's very clear they're pandering. And it was cringeworthy to watch this video. But in it, Dr. Fauci says, 4 years for side effect. I've never heard of that for any vaccine. Yeah, well, of course not, because you don't believe any of that can actually happen. So in your mind, you know what I mean? It was a completely worthless video, if only worth something because you could see how they were pandering, how it was trying to be using it as a tool to promote, Fauci's perspective or agenda, whatever you want to call it. And we know that potentially there is research saying potentially there may be consequences to vaccinating certain people. And we don't know what's going to happen when that enough spike protein accumulates. We don't know what's going to happen with that mRNA, infiltrating the nuclei of cells and perchance altering DNA permanently. We don't know what's going to happen with antibody dependent enhancement. We don't know what's going to happen with variants, and we just don't know. I mean, at the very least, we don't know. At the best, there's indications that there's some bad stuff that can.
Well, and now we're obliterating the control group. They want to
exactly. Oh no, let's just give it to everybody because it's the ethical thing to do.
So, in a scientific experiment, you have to have a control arm, and they're even doing away with the control arm in the Pfizer studies, saying, okay, we're gonna break the code, and you can tell if you got the placebo, and if you did, we can give you the vaccine. Well, their blinded control group is gone.
Yeah, destroying the data that we need long term. destroying the recording, the information that we need for long-term analysis, and then all in the name of, ironically, doing what's ethical.
Doing the right thing.
Doing the right thing. Let's do the
protecting the vulnerable.
Yep. Yeah. That I can't help but think that was planned from the outset, Yeah. And so, okay, it needs FDA approval. So now, the Association of American Physicians and Surgeons, then, what is their stance regarding FDA approval of these vaccines? I'm just going to ask, like, outright, blatantly. So I'm assuming that
we don't think the FDA should violate its own rules. And even if they approve it, it should not be mandated. We are against mandating anything. It should be up to the patient and the physician to make their own decision. They make their own risk-benefit analysis. And if the patient does not want a treatment, no matter how valuable you think it is, it's assault and battery to impose it on you.
So it seems like the strategy being used is not one of science, but of fear and guilt. Saying that you need the vaccine even if you've had COVID, saying that even if you're pregnant, you need the vaccine. If you're a child, you need the vaccine, and trying to instill this into the population at large, and not looking at the actual science and suppressing the science as it's coming out. We didn't even talk about myocarditis among young people, right?
How many boys have to have their hearts damaged? I mean, a couple of them have died. I think most of them have been released from the hospital, but have they been to football tryouts? Will they ever be able to engage in athletics? Could they become a firefighter or a pilot or a soldier or anything that requires strenuous activity?
Mm-hmm. It could be lifelong. And they're talking about it, being at least 25 times the natural incidence of myocarditis, probably more. And these are in young people who otherwise might not experience any serious adverse effects from the virus itself.
Exactly. And they would be even less likely to experience adverse effects from the virus if they had access to early treatment.
There you go. Right. So it boils down to early treatment and the access to that information, the access to the physical treatment itself. And so what can people do, Dr. Orient, in order to better protect themselves, in order to better educate themselves, given this assault of misinformation and fear mongering and basically lies? What can people do if they suspect that there's something else going on here?
I think they need to inform themselves, and they need to realize that they may be shunned by their family and by their friends. And first, one place to go is aapsonline.org, and you can download our little booklet, a free booklet about protecting yourself with vitamins and so on, and about early treatment. There's a site called C19protocols.com that has a number of protocols used by physicians successfully, and some resources about doctors who will do telehealth or who might be available in your own community. And patients really need to look out for themselves, because some of them are finding their doctors really don't care. One patient told me that she had allergies. She was worried about getting the shot. She asked her allergist about it, and he said, the government wants you to get the shot. Well, the government doesn't really care about you. And I suggest maybe you should find a doctor who cares more about you than about what the government thinks.
Right. Exactly. Because when you look at those government personnel, I mean, even the ones with MDs, you wonder what the agenda is, right? When you're in a position, I mean, it's human nature as well. When you're in a position of conflict of interest, major conflict of interest. I mean, people have something to gain personally, or people have something to lose personally, right?
There's a lot the doctors have to lose. I mean, their whole career. And the young ones particularly, they're up to their ears in debt. They're dependent on employment from folks who are totally dedicated to the NIH guidance of therapeutic nihilism, as Peter McCullough likes to put it.
Yeah, therapeutic nihilism. That was a nice term that he introduced me to. I'd read it before, but I think he coined it, right? He coined it.
So I think, as far as I know, he did, yeah.
Yeah. Before I let you go, there's one thing I do want to talk about that I think is very important, because there is, for instance, there was an article written by a paper, and in it they take jabs at the AAPS, among many other organizations. Yours was not the only one. And because I pride myself on being fairly well educated on this, I was laughing to myself at this attempt, because it was very clear they were taking things out of context. They were painting an incomplete picture. They were cherry picking things. They were focusing on one point when they could have focused on another, and they would have no argument. So it was like they were trying to build an argument where there was a very weak argument, and it didn't hold any water, at least not with me. So I was educating a friend of mine who was very concerned because she saw this article, and she was trying to talk to a family friend about her concerns about the vaccine, why she hadn't been vaccinated. And the family friend threw that article back at her. And she said, well, how do I argue against this? And I said, well, first of all, the whole basis of the article is erroneous. It's just, it's very clear that there's an agenda. And so what I'm finding is that the attacks from the media often focus around, they have a thesis and they want to support the thesis no matter what. So it's just like the idea that Trump was evil, therefore we're justified in saying whatever we want, however we want, and just take us for our word. We'll jump on the bandwagon of Trump bashing. And then people weren't very objective about what he had actually accomplished, what he actually done, and instead they were just repeating rhetoric, much like PolitiFact and Snopes and all these other so-called fact-checking sites, which are now incidentally, very, kind of, I don't even know what the word to use is, because they're certainly not embarrassed, but backtracking on the lab leak theory, right? And now saying there is some evidence. No, well, the evidence hasn't changed that much. We've got some videos of bats. We've got, a few, but the evidence has really pretty much always been there. You guys just were suppressing it or were lying about it. One of the two, or worse. And so it's like that. It's like these fact-checking sites. And so they have an agenda, or they have a thesis in mind, they have an idea, and they just want to support it no matter what. So there was an article, and I talked to Peter McCullough about this, from MIT that I found from last year. I think it was from last year. And in the article, they so blatantly attack by saying that, hey, now people are questioning the narrative, public health and government and the WHO and the CDC, etc., at the NIH and the NIAID, blah, 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 by using science. God forbid. And it's like, science is an institution, and these bodies can do it, but nobody else can do science. It's essentially what they were claiming. And that's not true. Science is not personal. Science is a method, and reproducibility and honesty. These are tenets of science, right? And so it seemed it really, really spoke of desperation when they were attacking science and saying they will use the scientific method. They will be educated in their attacks. They will seemingly draw from, be objective and draw from reliable sources in order to make their arguments. But don't mistake it now. They're wrong. They're wrong. And I was like, I don't believe I'm reading this article. I'd be embarrassed to put my name on this article, whether or not I'm from MIT. I think the head researcher's last name was Graham, I think. And it was like, you got to be kidding me. It's now they're getting so desperate, they're actually attacking the scientific method and saying that only certain people can use the scientific method. So have you seen this? Certainly you've seen this, but what are your comments to this?
Well, I've seen a lot of hit pieces on AAPS and on other people who are dissidents. I think it's good to remember that all of the really seminal advances in science has been made by heretics, starting with Galileo and Copernicus.
Isaac Newton was into some weird stuff later.
And the person who discovered that Helicobacter pylori causes peptic ulcer disease. And so all of these things, Semmelweis, if you look at the hit pieces on us, all I can say is if you want to know what we really said in context, go to aapsonline.org and read what we say for ourselves.
Yes.
And I think you could say that about anyone. Read the literature for yourself. Mm-hmm. That unfortunately what they call critical thinking in schools these days is mostly indoctrination.
Yes.
But if you're not willing to even look at the raw numbers in the table in an article, then you should not really be considering yourself capable of throwing rocks at other people who are doing science.
I agree. Whether it's, fact-checking sites claiming something's been debunked by just saying it's been debunked, to, looking at the objective numbers and learning what you need to know in order to understand and to see any inconsistencies, to see misinformation at the source, I think is very important. And most people, they won't do this. Or we should trust, we should trust. It's like, okay, trust. And there may be consequences to that trust, because the trust may be misplaced, because there's humans.
Trust but verify.
Trust but verify. Absolutely. Absolutely.
If people consistently lie, don't trust.
Well, and that's just it. And when you suppress someone's history, when you suppress their track record, and I don't care what anybody says, the past really is the best indication of someone's future behavior, which is why we have credit ratings, which is why we have criminal records, which is why we have, your report cards, the list goes on and on and on and on. You can't just magically say, well, now is now, and this is, it's like, well, okay, but people have reasons to do what they do. Have we changed those reasons? Really? Have they fundamentally changed? Is there some kind of ulterior motive or a lesson that's learned? There's no guarantee there. If they claim that there is, why is this any different? Like when you look at Dr. Fauci's track record with HIV, it's like, whoa, now poor Judy Mikovits is getting more traction. Whereas, boy, oh boy, that poor researcher has suffered, when you listen to her story and you read her books, but she's a God-fearing woman, and she's getting a lot more traction now, especially with the Fauci emails, and even Senator Dr. Rand Paul tweeted after the emails, appeared, "I told you so," right? I told you so. And so hopefully then this traction, we've got some inertia and some momentum, and it'll carry through. But I can't help but think that there's going to be, more movement. When I addressed ivermectin to you, I was thinking about one of our premiers of one of our provinces, Manitoba, and Pallister is the premier. And he was asked directly a question, very nicely, about ivermectin and have they considered the evidence for ivermectin and whatnot. And his body language was very telling. He grabbed his water, he took a big swig, he shuffled some papers, he listened to the question. There was no denying he heard the question. And then he answered, "We're looking at manufacturing vaccines here in Canada, and it looks like we're going to be able to do that." And something like that had nothing to do with the question. Completely ignored it, thanked everybody, and took off. How is that not telling? Like, why would you completely ignore a question? Why couldn't you just say, well, at this time we've looked at the evidence, the available evidence, and we don't think that it's viable. And okay, then now we have some foundation on which to debate and have a discussion. Oh, but I beg to differ. There is evidence. Let's take a look at the FLCCC website. Let's take a look at the, randomized control trials that are now readily available. Let's take at the recent study that came out in May on 18 studies showing that, ivermectin worked really well, right? And reduced mortality significantly. Why can't we just proceed with science? So I'm sorry, that's kind of rhetorical. I'm just rambling right now. Dr. Orient, you've been so gracious to us and so knowledgeable and patient. Is there anything else you would like to speak to right now? Please. I don't have anywhere else I need to go right now. I want you to take this opportunity. Are there things that we missed that you would like to speak to?
I think you've covered things very well. I think
you've covered things very well.
AAPSonline.org. We have a section, apsonline.org/mask-facts, if you want to learn about masks.
Okay.
But there's just a lot of op-ed pieces, press releases, or our journal, the Journal of American Physicians and Surgeons, jpands.org.
Okay.
Our spring issue and our summer issue in particular have a lot of information about the pandemic, its effect on the Oath of Hippocrates, its effect on our life. The study that Dr. Merritt did about the platelet things that have been reported to the VAERS. So I think that there's a search engine on there. Really encourage people to take a look at that and to download our free book. on early treatment.
Right. I did see that on your website, and I did spend some time on it. And I want to implore people, look at the source before, if you go look stuff up on Wikipedia, we know they're really biased, unfortunately. And there is a huge conflict of interest with Wikipedia. When you trace who they are funded by and what their allegiances are, it's very, very obvious, sadly. And most people won't take that step. Look at the source, right? Dr. Orient, look at the source, make up your own mind. But also when you see commentary and hit pieces, look at who's making those comments and what they're actually saying, whether they're just repeating things that they heard or whether they're actually providing some evidence. Look at their credibility, look at their background, what people are saying about them, and then look even further, dig and dig and dig. And eventually things start to, as I like to say, patterns start to emerge, pattern recognition. You want to be good at pattern recognition. You start to see things that you otherwise weren't privy to or weren't conscious of. This is how you educate yourself. And nobody's perfect. And there'll be hiccups along the way, but this is how you educate yourself. You learn along the way, but don't take things at face value. And certainly when it's something controversial or your health is involved, really look at the source first, make up your own mind, and then start looking at secondary sources, tertiary sources, things like this, and make up your own mind. Because if you rely on certain big organizations or individuals and things, realize that there's agendas at play. There's huge conflicts of interest in the pharmaceutical industry, politicians, government, individuals themselves that would never stand the test of time in other areas. And I use the analogy in sports, because I have a background in sports and such. And there's things that happen in the corporate world, the political world, the industrial, the pharmacological industrial complex that would never hold in sport, except maybe FIFA, or figure skating. But that's another story entirely. But am I right, Dr. Orient, to say these things?
People really need to think for themselves and read for themselves. And if they see the same rhetoric occurring over and over and over again, chances are it's being cut and pasted and retweeted from certain sources that have an agenda.
Right. And I know from speaking to friends and other individuals, some of whom I've interviewed, other countries are taking steps. Poland has taken a very bold step in in how they view social media. If they think that social media has had a role in suppressing information that has backing. Reasonable backing, scientific accuracy, if they think that it's being suppressed, they can be criminally prosecuted. And so they've used this successfully to de-censor things that they've censored, put that fear. I've personally seen email exchanges to this effect with certain social media platforms and or representatives thereof, and that is hopeful. That is hopeful. But just because you're a big company with lots of money, whether you grew out of someone's garage or not, does that give you the power to make health policy decisions, right? And not only that, but influence millions of people in their behavior and what they do to protect themselves and to facilitate their own health and wellness. And I know you said let's not worry about accountability, let's worry about getting the truth out, but I'm like, I don't want this to happen again. I don't want any loopholes. We got to hold people accountable in some way, shape, or form. I'm not confident that's going to happen. I do think there will be changes. You mentioned to me about your hope and your belief that the mass media will be replaced in some way, shape, or form with something better. Can you comment to that a little bit, Dr. Orient?
I think we need a return to honest journalism, just like a return to honest science. And we've got a long way to go there, but I think that maybe if they're completely discredited by this crisis, it will help. But for now, I think patients need to think for themselves, and hopefully they can find an independent physician who will care about their welfare and not be dependent on big pharma and big organized medicine and others that have a different agenda.
You're a longtime physician with decades of experience, both clinical and in what you do administratively. I am an academic physician and have worked in industry. And my experience does not compare to yours. I bow to your venerated status, Dr. Orient, and I say that with all seriousness. But I do have sympathy for physicians, given what's going on. But there are some choices that need to be made, and there are some stances that can be taken without necessarily hurting oneself, right? Like, no one's saying you need to go out there and shout at the top of your lungs that I am now giving, prescribing ivermectin, and I'm not even sure what the exact status of it is here in Canada. I heard a disturbing rumor the other day, but I really have to check up on it. But there are some things, and I've heard what certain physicians are doing, and I won't say exactly where or who, of course, but talking to their patients, what you were saying, to be educated and to look at the sources, to make up your own mind, especially with regards to a vaccination, and the so-called vaccines, the experimental gene therapy, really, vet it, and then vet those who claim to be vetting, make the effort to educate yourself as best as you can. Is there any other advice, Dr. Orient, that you can give to people out there? And I know there are many, millions, literally, that are confused and that are uncertain of who to trust and what to do. And I know this is almost a rhetorical question because you've already spoken to this, but is there anything else that we can do in terms of how we interact with others, in terms of, because I know physicians that just keep their mouth shut. I know people that work in government that are keeping their mouth shut. I know that people that work for certain organizations that are, keeping their mouth shut. I guess, I'm asking a question that's very difficult to answer and can only be answered on a real personal level. But what are your thoughts?
I think, as Alexander Solzhenitsyn said, the most important thing is live not by lies. Speak out, speak the truth loudly and clearly if you can. If you cannot, because to protect yourself and your family, at least do not live by lies. Do the best you can to keep your thoughts honest.
I think that's a really good way to end this interview. Dr. Orient, and I want to thank you on behalf of myself, Dr. Sam Dubé, and the Toronto Business Journal for joining us on behalf of all of our viewers. And I hope this was informative to our viewers. And I would love to interview you again in the future, Dr. Orient. I'm going to make you commit now, if that's okay.
Sure. Great talking to you, Dr. Dubé. Thank you for what you're doing.
It was wonderful speaking with you as well. And I'm going to sign off for us both. And please don't go away. And I will include the websites that you mentioned in the video description. So thank you so much, Dr. Orient, and stay safe and keep up the great work.
Thank you.